Assalamu alaikum and welcome to the Dr. UUT lectures. The topic of today's discussion is about arthritis. So we will talk about the osteoarthritis, rheumatoid arthritis, and gout in a very brief and to the point way. So in order to give you the very basic idea of these particular points, and we will let people about let you know about the treatment a little bit also, not that much. Well, arthritis. First of all, let's clear the term arthritis. What is this term actually talking about? This term is actually made up of further two sub-terms. The very first one is arthron, the second one is itis. Arthron-itis, we write them together as arthritis. Arthron means joint. What does it mean? Joint. And itis means inflammation. Inflammation of the joint is called osteoarthritis simply. Well, we have osteoarthritis right now here are with us, rheumatoid arthritis and gout. These 3 points are with us. We are supposed to discuss these three now. So first of all, let me clear this more further. The inflammation of the joint is called arthritis. Inflammation of the joint is called arthritis. Now what is joint? Inflammation we know, but what is joint? Joint is actually the area where two bones meet, or more than two. One bone, second bone. These two bones meet. The area is called joint. So when we observe inflammation in the joint, that will be called as arthritis. Here I have mentioned the knee joint. Knee joint. Okay. So I will clear your concept regarding the osteoarthritis and rheumatoid arthritis via this example. Osteoarthritis. Osteo means bone. Arthritis is actually joint inflammation. Itis, inflammation. Arthron, joint. Osteo, bone. Osteoarthritis, bone, joint, inflammation. Okay, very simple. Don't be confused. Now, what is actually this particular term talking about? Osteoarthritis. In case of osteoarthritis, let us consider the knee joint. Now, what happens is actually in osteoarthritis, one bone, another bone. These two bones are actually joined via this particular space, and they have a specific covering that is known as cartilage, specifically known as articular cartilage or hyaline cartilage. This cartilage actually protects this bone, this is the second one bone. Okay, the bone, this one, let me call it as A bone, bone A, and bone B. So the bone A is covered, protected by the cartilage, articular cartilage or hyaline cartilage, and bone B is again this covered by the same kind of the cartilage. What happens because of mechanical stress, because of overuse of these bones, because of the age and some other factors that are actually seen with the age? So the more you move, the more there are the chances that you may get the damage of this particular cartilage, called as articular cartilage, which is actually covering the particular bone. When this fails down, or when this is removed because of certain reasons that I mentioned a moment earlier, stress, overuse, age, blah blah blah, what happens then is that this bone is exposed now. So when bone to bone movement occurs, you will hear sounds, cracking sound, tack tack. Oh, these kind of sounds will be observed, will be heard. So this is because of what? Because the cartilage is now no more available, or it is actually shutting down. Okay, it's wearing down. So what is happening then? This may lead you to the bone disorders, bone uh, pain. Okay, so we call that then as osteoarthritis. Osteoarthritis, if there is a damage seen of this particular cartilage. But this is osteoarthritis. Now I told you now this is actually related to the age and stress and overuse and mechanical stress like that. Okay, this is called actually osteoarthritis. Now we have the next term, rheumatoid arthritis. Now what does it mean? Rheumatoid arthritis. This is actually the inflammation seen in the joints, in so many joints. Along with that, in case of rheumatoid arthritis, you will see inflammation in some other parts of the body also. God, now this is inflammation not only of the joints, but this will be in some other membranes of the body, organs, okay? Like heart, etc. It can be destroyed, damaged by the rheumatoid arthritis. Now, how rheumatoid arthritis is different from the osteoarthritis? Osteoarthritis is actually specific with the bones and with the joints. That's why it is called as osteoarthritis. Arthritis that is specific with the bones and with the joints. More specifically, osteoarthritis is actually dealing with the bones that bear weight. For example, our hip bones and our knee, okay, knee joints and hip joints. They are mostly affected by the osteoarthritis. Means because of the age, because of the stress, because of the overuse of with the age. So these factors are actually observed and can be seen in the individuals because of obesity. Okay, so there is weight. Okay, the weight bearing joints are mostly affected by the affected, like their cartilage may be removed. So that is actually then called as osteoarthritis. Now sometimes that is not just only the removal of this cartilage, but there is some another factor responsible to remove this cartilage, and some other uh, malfunctions are actually caused. That is actually then not only osteoarthritis, then that is called as rheumatoid arthritis. Now what is rheumatoid arthritis? Very simple. In case of knee joint, let me clear this rheumatoid arthritis again with the knee joint. What happens actually is our this A bone and B bone, they are covered by the cartilage, and between these bones there is actually a fluid called synovial fluid, which is actually secreted or made by the synovial membrane or synovium, which lies very next to the bone, surrounding the bones. Okay. Then we have a ligament that actually connects this bone with this bone. This is the ligament in the blue. Okay. This is the ligament. Ligament actually connects one bone with the second bone and holds it. Okay. And then we have synovial membrane, which is actually releasing or producing synovial fluid. You know, when the fluid is available in the joints, then it is easy to move. Okay. So what happens then? Sometimes our immune system that becomes crazy enough when the immune system starts attacking our this synovial membrane and synovial fluid is then not produced. When the synovial membrane or the synovium is disturbed, then the synovial fluid will not be produced. If the fluid is not available, then we know when there is no fluid, then the movement between the bones is actually disturbed, and then we will feel discomfort. And again, when there is no fluid, there will be the increase in chance of friction. Because of the friction, again the cartilage will be removed. Now this cartilage removal is because of what? Because of a long process of the immune system. Our immune system is disturbing our joint. How? Like this immune system comes and attacks the synovial membrane, the synovium, then there is no the synovium, which was responsible to synthesize synovial fluid. Now the immune system has attacked it, and the function of the synovial membrane or the synovium is not no more available now. Now there won't be any sufficient amount of synovial fluid synthesis. So when there is no synovial fluid available, then the friction will increase. You know, there is less fluid, more friction, and that friction is causing what? The removal or the wearing down of the cartilage. Which one? Articular cartilage. So what happens then when the cartilage is no more available, then this bone will be exposed to the next bone, and the friction will increase, and increased friction will cause again the inflammation, the pain, the uh, and there may be a kind of stiffness even observed. Why? Because then this bone starts making ossification, like making some more bone-like structure. Then the joint become a kind immovable. Why? Because now the entire space is then filled by a new type of bone. A bone formation will take place between these two bones. So that is because of what? Because of immune system now. So such kind of disorder that is observed because of our immune system, that will be called as rheumatoid arthritis. So remember guys, rheumatoid arthritis is not specific for the joints only. This may affect our immune system, may affect other membranes of our body. Just I gave example of the heart, and some other examples are available. So this is not only specific with the one joint. Another point is that if a person is complaining to you of knee, so if a person complains that I'm feeling pain in one knee, so your diagnosis skills must move you towards the osteoarthritis, because this osteoarthritis is actually asymmetrical. Means this only affects one side of the body. If one side of the body is affected, the second will not be affected or may not be affected. But in case of the rheumatoid arthritis, this has an opportunity, this has the chances to affect your body symmetrically. Means if your right knee is affected, your left knee will also be affected. Okay, so possibility is more as compared to osteoarthritis. So this is the point that I'm telling you guys. So in case right now, let me brief it again. Arthritis, osteoarthritis, and rheumatoid arthritis. So in case of osteoarthritis, your bones are affected, your cartilage is removed, which is actually the protection between the protection for a bone. And if this cartilage is removed, then the friction increases, and with that, then inflammation and pain and stuff like that is observed. Okay, so in case of osteoarthritis, it is just because of the mechanical stress, because of the age, because of the overuse of the bones. So the joints will be then affected. But in case of rheumatoid arthritis, it is not only the stress and etc. But the beginning is actually from the immune system. Our own immune system starts this particular damage. When the damage is happening, then it is worsened by because of the stress, because of the bone exposure, because of the bone overuse, because of the age again. Then all these factors again add into the rheumatoid arthritis. So osteoarthritis is actually separate from the rheumatoid arthritis. In rheumatoid arthritis, immune system is responsible, immunity is responsible. In osteoarthritis, only a person oneself is responsible. Weight of the person, obesity, stress, overuse, sports, injuries, etc. Those are responsible. But in the rheumatoid arthritis, the very cause is from the immune system. Then these will add together, will worsen your arthritis. Which one? Rheumatoid arthritis. Now let's come toward the next one that is actually called as gout. This is actually the arthritis most often observed in the toe. Okay, big toe. So what happens then? This is actually because of the uric acid. Now here age is responsible, here immunity is responsible, not only age, stress, overuse of the bone, immunity specifically, and in the gout there is actually uric acid. Excess uric acid synthesis in the body will lead you or may lead you to gout. What happens actually in gout is the uric acid is actually synthesized, and that uric acid then moves and forms the crystals, and then that again leads to the joint inflammation, pain, redness, and stuff like that. So it's a very quick sort of disease and very intense sort of that is a gout. So gout is actually because of the uric acid, and rheumatoid arthritis is because of the immune system, and the osteoarthritis is because of the mechanical stress like that and stuff like that with an age. Okay. So, an interesting point that I want to put right now here in the discussion is gout is actually can be called as, because of the reading that I got, gout is actually called as the disease of the kings, okay, or a rich man's disease. This is actually a very famous point regarding the gout. Why? Because this is caused by the overuse of or excessive use of the red meat and fish. So before, when there was no that much access to everyone of the red meat and fish, so all those who were rich and king used to get this particular food or diet. So they were often affected by the gout. So they were actually seen only that they have gout. The rest of the guys they were not having gout. So mainly this is because of the diet. When you consume uric acid from your diet, and that uric acid is even if synthesized in the body so much and that is not removed from the body, and then that uric acid moves and accumulates in the joints and then causes you the gout. Specifically, the big toe is affected. And in case of rheumatoid arthritis, I told you it's because of our immune system. Our immune system damages our synovial membrane and some other membranes in the body. Not only joints are affected by the rheumatoid arthritis, why? Because it is because of the immune system. And in case of the osteoarthritis, only joints are affected. So that is because of what I told you in the beginning: age, mechanical stress, obesity, and etc. So that is a little bit from my side. I hope you got regarding treatment point of view. We have certain other examples, like we have answers, steroids and topical steroids, topical medication and injections, blah 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 are available. So we have discussed some in our other lectures. So you can search out about those treatment strategies in our other lectures. So this was only for kind of awareness purpose and telling you people about the brief idea of the arthritis, osteoarthritis, rheumatoid arthritis, and gout. I hope you got. If still you have confusion or questions anywhere, you can ask us in the comment box. And thank you for watching Dr. UUT Lectures.